Howdy, y'all, and welcome to Respiratory System 1. This podcast will deal with sound production. This is an actual photograph taken with an endoscope down into the larynx. So, the top, it shows the epiglottis. So, if you've listened to the previous podcast, you know that the epiglottis is an elastic tissue that closes over the space called the glottis, which in this photograph you can see is that space where the vocal cord, so if you find the vocal cord, it's a boundary around the lumen of the trachea. That area where the vocal cord is surrounding or partially surrounding the lumen of the trachea, that is the glottis. And when you swallow food, the epiglottis closes on top of that space so that food will go posteriorly to the esophagus instead of anteriorly into the trachea. In addition to the vocal cords, which are also called the true vocal, excuse me, which are also called the true vocal cords, there are vestibular folds, which is a tissue that is on the periphery of the vocal cord, and that vestibular fold acts as a sphincter when you're coughing. And we'll talk about the vestibular fold in a couple slides. Also, in this photograph, there's the corniculate cartilage. So there's a lot of cartilages associated with the larynx and production of sound. You don't have to memorize all the names of the different cartilages, but we will take a look at them in this podcast. So in this cartoon, it shows you the different cartilages and cords and muscles associated with sound production. So it's quite complex, and it's a fascinating thing that we are able to produce the sound and the vocabulary that we can. So let's look at the cartoon. If you find the thyroid cartilage, and then you can see that the vocal cords, or the true vocal folds or true vocal cords, are attached to the thyroid cartilage, and they're just thin pieces of tissue. Posteriorly, the vocal cords are attached to the arytenoid cartilage, and that arytenoid cartilage then communicates with a corniculate cartilage, and then there's the muscles associated with that. Like I said, you don't have to know those names, just you do have to know that there are vocal cords that can abduct and adduct. So in this cartoon, if you remember from 201, adduction means to move toward the midline, and abduction means to move away from the midline. So when you make a sound, your vocal cords are adducting and abducting. So your vocal cords can vibrate on demand when the intrinsic muscles move them. So in other words, when you decide to talk, the intrinsic muscles will move the cartilage, and then the cartilage will move the vocal cords back and forth, and they'll vibrate. And as air passes across the cords, then that leads to sound production. So sound has a lot of different qualities. Sound has pitch. So you can have high pitch or low pitch. You can imagine when the vocal cords are vibrating back and forth at a high frequency, you would have a high pitch, and when they vibrate back and forth at a lower frequency, you'd have a lower pitch. And pitch also has to do with not only the vibrational frequency, but also the thickness of the cords and how tight the cords are. So usually males have a longer, thicker vocal cords than females, so they have a lower pitched voice. The cords obviously change their length and tension and thickness at puberty. So under the influence of testosterone, the cords in males would become longer and thicker. Obviously, you can, whether you're male or female, you can change your pitch if on demand. If you want to have a higher pitched voice, you relax your cords. I'm sorry, you tighten the cords and you have, call on a faster vibration of the cords to get a higher pitch. And then when you relax the cords, you have slower vibration and a lower pitch. When you whisper, there's no vibration and there's no change in pitch. Now, in this cartoon, you can see at the bottom of the slide, you see the base of the tongue, and then you have a little connection between the base of the tongue and the epiglottis. Remember, that's that elastic fold of tissue. And then you can see the vestibular fold, which is sometimes called a false vocal cord. And then you have the true vocal cords. And then this cartoon, it actually shows you the glottis. That the glottis is not a structure, but rather it's a space. And then it shows you also the corniculate cartilage that the posterior end of the vocal cord attaches to. So in addition to a high or low pitch, your sound can also be loud or soft. So loudness, then, it's due to the force of a certain volume of air moving across the vocal cords. In addition, your lips, so the genetic lips that you got, the genetic tongue, the genetic teeth, the genetic sinuses that you got in your skull, all of those will shape the sound of your voice. So the resonance chambers then are just the chambers where the sound can resonate. So for instance, in your the shape of your nasal cavity, your oral cavity, the shape, like I said, of your sinuses in your skull, all those are resonance chambers that allow sound to have a high quality or a lower quality resonance. If you get an inflammation of your vocal cords, that's called laryngitis. And that can happen just if the air is very dry, or you can have a bacterial or viral infection that gives you laryngitis. So a little more on the false vocal cords. Those are also called the vestibular folds. So they have a sphincter function. So when they close the glottis, they prevent air passage into the trachea. So now you can do this experiment, right? Just cough, so you can understand that just prior to the cough, you can sort of feel this. The false vocal cords will close, and that's going to increase the pressure in the from the diaphragm, and that's going to increase the velocity of flow of air when that air passes through your false cords. You also use your false vocal cords in a sphincter function when you are expelling your feces